Hi, I'm Jeff Apodaca.
Eric Strauss.
Welcome this week to our show, and we love
episode. What are we at?
I have no idea.
Episode.
You know what?
5?
In fact, after every show, no, God, we're doing more than that. After every show, I try to forget about what we talked about because
I try to forget you too.
But we always start
etched into my mind.
We always
I'm
start
actually
up,
talking
hold
about
on.
you on my radio show.
That's
now.
a good thing. That's a good thing. By the way, it's about meeting in the middle, right?
Yes.
Anyway, we're talking about meeting in the middle, and so last week I think we talked about this, and I had to bring it up. So last week Trump was here, and I guess they had a fundraiser at Casa Rodeno.
Yeah. I covered the Trump rally extensively.
We talked about that last week, but it's a winery that basically has, they do events.
Yeah.
And Diane Danish, our wonderful former lieutenant governor, who, by the way, likes to rant a lot more than Trump does.
Is she even in office anymore?
No, she hasn't been in office a long time, but she tweeted out to boycott this business. There's her tweet right there.
Yeah.
She tweeted out to boycott, and she got firestorm against her, and I actually came out against her.
Why would you want to boycott any business?
And by the way, Casa Rodeno is a great place. It's a winery. They do locations. I've been there for Democratic fundraisers, by the way.
They did an event for Bill Richardson.
Well, for a former politician to come out and say we should boycott that.
Any business.
Any business.
Business is hard enough already without people trying to boycott you.
So I'm going to plug them. If you want a great glass of wine, by the way.
It is good wine.
It's a good wine.
I was part of their wine club and everything. My story is about a woman who pulled over for an injured bobcat, wrapped it in a blanket, and put it next to her 3-year-old son.
What? 3-year-old?
Who was strapped into a car seat, a 20-pound injured bobcat.
Yeah. Next to my kid, that wouldn't happen. And we have kids. I don't think that would happen.
I think that's irresponsible parenting, and that's just yet another example that we need a license. Well, they want to license everything. Let's license to have kids.
Well, I can tell you right now, the next topic I want to talk about is, you're not going to agree with me, because I saw that Trump last week came out in California saying we should create federal guidelines on car admissions, and he thinks California is too lax. And I want to show you. I moved
too strict?
Too strict.
Yeah.
I moved to LA in 1993.
And he's talking about gas mileage.
No, he's talking about emissions. He's talking about fuel and emissions. And I'll be very frank.
Yeah.
You pay higher car taxes, and you pay higher for your car in California. Gas is about 38 cents
You
more
pay
expensive.
higher everything.
Okay, but hold on. Gas is more expensive because in 1993, we voted. I live in California at the time. We voted to put those clean emissions into our cars because, let me show you a picture. 93, this is LA. This was the smog in LA. My office at CBS at the time, I was a mile away from the CBS, from the Hollywood sign. Mm-hmm. There were days you couldn't see it. In fact, I went and looked New Mexico. Show the next one. New Mexico. Look at that. Look at New Mexico smog in 2017. That's just a few years ago. So my point is, hold on. My point is,
grainy photograph.
No, but my point. You can go Google.
Let me put a grainy photograph.
But my point is,
up too.
The last time I looked, our Constitution gives the states more authority over the federal government.
We can agree. I can agree with you there.
So if California and their voters vote to put 38 cents more gas cleaner, because the gas costs more money, cleaner in their tanks for fuel. When I moved to California, they would have over 200 smog days. I didn't even know what a smog day was. They'd have 200 smog days. How we have snow days here, kids don't go to school. There were days kids didn't go to school, and now they have no smog days or very small alerts. So,
and probably because of technology, there's this thing called technology.
Hold on.
Yeah.
But that's what they put in the cars, and they have emissions, and they put cleaner fuel that we could do around the country. So that's one of the things.
But now they're saying that electric cars are polluting the environment.
We're not talking about electric cars. We're not talking about electric cars. We're talking about gas emission vehicles.
I mean, with everything. So
that's one thing you and I. That's one
the city council is now taking it upon themselves to pass gun legislation. Which I don't know about you.
They can't pass gun legislation. They passed
city ordinances making legal citizens criminals, which is ridiculous. If you get a gun stolen out of your car, it's your fault. Which is the dumbest thing I've ever. It's the dumbest thing I've ever heard.
Again, cities can't create state laws, and so
they're trying to do. The city council is trying to do all kinds of dumb stuff.
The state's going to overrule that. Anyway. Today's show, we're going to be talking about health care. We're going to talk about Eric wants to give everybody free health care.
I do not. Quit saying that.
That's exactly what you told me.
No.
Everybody should have free health care.
I have never said that.
Anyway, we're going to be talking, should we go to Medicare for all?
I have never said
we're talking about the New Mexico.
As a matter of fact, I'm in favor of private health care.
Can I finish? Anyway, so tune in. We'll be right back. We're going to be talking about health care and health initiatives, hey,
Let's meet in the middle.
In a time of a divided America, two people from different points of view sit down to talk about the problems, to talk about ideas, to talk about life, and to find common ground. It is now time for Let's Meet in the Middle with your hosts Eric Strauss and Jeff Apodaca.
Welcome back to Let's Meet in the Middle. Joining us now is Mary Felberg from the New Mexico Health Security Act. And we were talking before you came on air here, and I want to break down just initially, what's your role when we talk about New Mexico Health Security Act? Explain it to somebody like me who has no idea what this thing is, as simple as you can, okay?
The elevator speech.
Yes, yes, thank you. I do that with my kids, my students.
I'm being quiet here. You told me to don't interrupt.
Go ahead. Mary.
Okay, it's the Health Security for New Mexicans campaign is the largest coalition in the history of our state, over 170 organizations. We've been working on this plan for over 20 years. We've gotten feedback from around the state, from doctors, businesses, all kinds of groups. And essentially, we all know our system is broken. While the Affordable Care Act has reduced the number of uninsured dramatically, the cost issue is a major problem. Not only that, many patients are finding that their networks, their physician networks are smaller and smaller, and people are paying higher deductibles and co-pays, and it's not just the premiums anymore. So what this plan, we're a state with a very small population. The market is small. The idea is let's set up our own health plan. And how you do it is what we've been asking people. What are people worried about? So most New Mexicans would be automatically covered by this plan. The military retirees, federal retirees, for a lot of legal reasons, would be out and out excluded. The tribes as sovereign nations could voluntarily join. And those companies that are come under ERISA, federal law, can decide, and this would be the public option for them, can decide whether they want to join or not. So the services offered can be no less than what the state employees have and the teachers have. It's a good package of services, mental, physical, hospital, acupuncture, chiropractic treatments. Freedom of choice of doctor and hospital. No more networks anymore. You can go to the physician and doctor of choice, and we've got New Mexicans on the east side of the state. They go into Texas. So this plan, like any insurance plan, will be able to negotiate across state lines. It would be administered not by a state agency. Nobody wanted a state agency doing this. So it's akin, that's what the farmers and ranchers in the northeastern side of the state said, this sounds like a co-op. It would be a citizens board, 10 representing consumer and business interests, 5 representing provider interests. Nobody from the insurance industry can sit on this. The members of the board must be recipients of the plan itself, because when you
who appoints the board?
We'll get into that. It's a critical question, and it has to be geographically representative. Having traveled around the state for years, the perception that it would be an Albuquerque or Santa Fe dominated commission was anathema to people. And so actually the majority on this board, 9 out of the 15, will come from outside Albuquerque and Santa Fe. This is a big change for New Mexico. Obviously, the employers and individuals could purchase supplemental insurance should they so choose. And the private insurance industry, like Presbyterian, could serve as a third-party payer, as long as the claims are processed in New Mexico. That's a caveat.
So let me ask you a question. So you guys have been pitching this for 20 years, and I'm going to be very frank to our viewers. I support this. I support you guys. I think it's a great idea. For 20 years, what's stopping this from being implemented as a state as a third-party program for insurance in our state? What's stopping it?
Well, the first thing that stopped us is that there was in the early 90s, there was both Bush and Clinton were talking about national health care reform. And in fact, the Clinton plan, when he became president, and then managed care, all of a sudden managed care was the code word for solving the cost problems. And then we also, of course, have had the Affordable Care Act. But this is a major, major mind shift, a paradigm shift. And we're basically a volunteer organization.
What's stopping New Mexico
From
accepting and enacting and putting this into play?
Well, you need legislative support and governor's support to do this, and you need the public, and you have to. This is a personal issue. This is the most personal issue I've ever worked on. If I'm a senior, I have a supplement. What's going to happen? What's going to happen if I'm out of state?
Okay, but let's go back. If the legislature, you have 160 organizations.
170. Yeah.
170 organizations, 30 or so cities and municipals. If the legislators are supporting this, and I see on your website, and I supported it during the campaign, we all talked about it. You're claiming that the governor's for it right now. Why aren't we pushing this through our legislators and getting it on the plan like next year?
Well, what's exciting is this past session, the legislature authorized funding because in the first phase of this plan, it never was going to be implemented right away. It's like, is this affordable? Yeah. You know, and by affordability, I mean, you've got to predict, you've got to be able to calculate, because I'm a social scientist, the cost of this plan, and then the revenue side, you know, and if the revenue side can't pay for the cost, assuming state employee services, then it's not fiscally viable. So there is money available now for the Legislative Finance Committee to hire the consultants to engage in this. And this is going to take until probably October of 2020. We don't even know what we're spending on health care. If you don't, that hasn't been collected in a long time. If you don't know what you're spending, you can't project any kind of program, in fact. And so that's phase one. If indeed it looks good, then in the 2021 legislature, the legislature is going to have to make a decision about whether this is a go. And it's still going to take a long time because there's a lot to work out with doctors, hospitals, with consumers.
Hang on, just give me 1 second, because I just want to pull the reins back just a bit, because I'm still, I don't think we're at a point now where we've wrapped our arms around this thing. As simple as possible. I'm a father with 2 little kids and a wife, and the insurance goes through me. Right now I'm on Presbyterian. Your organization, New Mexico Health Security Act, has legislation behind it. This is happening, it's already done, or this is what we're proposing, that Eric Strauss on Presbyterian insurance 5 years from now, 1 year from now, will buy into the New Mexico Health Security Act? Or that's what I'm kind of, I'm trying to get my arms around what this means to our audience out there watching this show, like, because this, like you said, is a very personal issue. My healthcare insurance has gone up every year, premiums have gone up, and you're saying we're creating a coalition of 170 organizations. I'm just trying to bullet point this thing, where it's doctors, chiropractors, and everybody's jumping on board to say, we're all going to pay into a New Mexico Health Security Act?
Not act, a plan.
A plan.
A plan.
So it's a health...
Hang on, I just wanted her to give her bullet points real quick. Go ahead.
It's creating our own health care plan that covers almost all New Mexicans. So instead of getting your insurance through Presbyterian down the pike, with your Presbyterian network, you're going to be part of a large risk pool, economies of scale, because there's no question larger numbers, and you won't have a limited network of providers. You will have freedom of choice of doctor and hospital, and you will have the services that you have right now as a teacher, because that's what we're guaranteeing.
And then you can supplement it, correct me if I'm wrong, Mary, you can supplement it, catastrophic, other things, you can supplement it with the private sector
So they're
insurance.
taking my money I'm spending on Presbyterian, and they're going to pool that into this
co-op.
Big pool of money.
That's ours.
It's the state of New Mexico. So think about this, it's self-insuring ourselves across the board.
But it's our money.
Right.
It's not going to go to a private insurance company anymore. It's going to be our pot of money. And we're talking about billions of dollars, even at 1% interest, is going to raise a lot of revenue to help build infrastructure in rural and underserved areas, to have a reserve fund, which it must have. It's going to give us health security. because right now people are very insecure about their insurance. While people may love it, when you have a catastrophic problem in your family, you don't know if you're going to be covered.
Well, and I think, Eric, what we've talked about in the past is both, and I'm an independent contractor, I own my own business. There's 7% of us that literally our costs have continued to go up.
Yeah.
So and I think the good thing is we all, maybe not you, but we all support Obamacare and insuring everybody. My biggest issue, my biggest issue with Obamacare, is the two major issues that they didn't address was insurance cost and pharmaceutical cost. And correct me if I'm wrong, Mary, with us self-insuring ourselves, that now means we can negotiate our own pharmaceutical costs.
Right.
So that's what I'm talked about in the past, is we can literally create our own pharmaceutical cost, leverage down almost 70% of our cost just on the pharmaceutical side, because now we're buying for the whole state, not individual plans that make profit off it.
So here, out of the gate, my number one issue with Obamacare was all of my doctors quit. I can't keep a doctor. Matter of fact, I don't even think I've seen a doctor in probably 5 or 6 years. All I see is physician's assistants. Every doctor retired or quit out of the plan. And this is my major rub with these overall large risk pool issues. The guy in the middle is the one that eats it every time, because the guy at the bottom rung gets all the free stuff, and the guy at the top rung, his costs just go up. He can afford it.
So Mary, let me ask you.
And so the guy right in the middle, like me, got no doctors, haven't seen a doctor in probably 6 years, prescription costs up, everything went up. So it's great that you paint these like rose-colored.
But hold on. But Mary, do doctors support this plan?
An enormous, we're getting growing numbers of physicians.
The doctors are supporting this plan because they know the doctors will get paid more on this side too, because a lot of the costs are going to the insurance side.
Well, it's more than that. There is something called physician stress that's going on. There's actually an enormous number of suicides going on in the medical community around the country. There are studies that show that physicians spend 3 times more time on the computer dealing with inputting information than they do with the patient. And that is due to the demands of the insurance companies that are requesting all this kind of information, some of which is whether they're going to pay the claim or not. And we have an opportunity in New Mexico with physicians to actually set up a system that collects the data that's needed to ensure quality of care, but simplifies life for physicians so they can spend time with patients and not so much on the computer. Physicians are stressed, and that is part of the problem.
Go ahead.
Well, no, and so one of my points is 52% of our citizens are already on some type of government health care program already, Medicare, Medicaid, things like that. By us self-insuring, I mean, an example is, and I'm not saying this is a perfect example, but the New Mexico Mutual, right, which is workers' comp, right? Mm-hmm. We had a huge issue with workers' comp years ago, and we decided to start the New Mexico Mutual Fund with $10 million, and everybody businesses paying into that. We now have some of the lowest workers' comp fees because New Mexico Mutual, you can pay into a co-op, and I don't want to say New Mexico Mutual is a co-op, but it's very similar to that. And we started that, and now it's billions and billions of dollars for New Mexico businesses, and now we have some of the lowest costs based on that because of the pool that's locally here and invested here.
So, again, I don't know what workman's comp you're paying into. My wife complains about workman's compensation insurance all the time. So if it's low, it's gone.
Well, part of the reason is health costs. 50% of the workers' comp, even more, because they have annual reports, is health care related. And actually, under this plan, you drove here, I assume, automobile insurance, that includes commercial as well as private passenger, and workers' comp. They have large health components, and those can be reduced. The superintendent of insurance is required to look at them, because if this plan pays for the injury, right, you shouldn't pay double.
Well, we're going to have to go to commercial break. Okay. Stay with that. We'll be right back, and we're actually having a doctor join us, the conversation. But thank you, Indigo Mortgage, P&M, and Ryan Soenbach. We'll be back right after this.
I'm Ben Lucero, president and owner of Indigo Mortgage. We are a locally owned and operated mortgage company right here in New Mexico. This means your loan officers and processors are right here to serve you. Indigo Mortgage offers better rates and terms than that of big banks and out-of-state lenders. Our mortgage divisions include residential, commercial, construction, reverse mortgages, and VA mortgage loans. Let us serve you with an exemplary level of care. Indigo Mortgage, because nobody cares more about your mortgage loan.
We are connected by rivers, by mountain ranges, by unique culture. But what connects us more than ever? Renewable energy from wind and solar. P&M delivers renewable energy every day to our homes, businesses, and institutions across the state.
And they are committed to 100% emissions-free energy by 2040.
After all, we call this home too. P&M, together for New Mexico.
Ryan Sewing and Vacuum is New Mexico's #1 brother dealer. Brother's new Luminaire has a built-in projection system which helps with quilting, embroidering, and sewing. Ryan's has a variety of machines to satisfy quilters, sewers, embroiders, and long armors. We offer the finest vacuums like Miele, Riccar, and Lindhaus. Check out our fantastic selection of fabrics and sewing furniture. We also offer classes, repair, and financing. Drop by our store in Albuquerque and Santa Fe. Ryan Sewing and Vacuum, serving New Mexico for 37 years.
Welcome back to Let's Meet in the Middle. We're on with Mary Feldburn. You are part of New Mexico Health Security Plan, and joining us now is Jody Mayfield. She's a pediatric oncologist.
Yes.
And I know I'm saying that right. See?
I think you did.
That's why I get paid the big money.
And don't forget that we're live on Facebook.
Yep.
And so if you want to jump into the conversation, jump in live on Facebook. I'll try and answer some of your questions, go back and forth. And if we don't get to you, we'll try and get you through the week.
And by the way, if you go into Ryan Soenbeck and mention Let's Meet in the Middle, he'll give you a discount. So there you go. Jody, for our audience, let's just start with your experience, what you do, and how you work with children with cancer.
So I am actually a local New Mexican, so I went to med school here and went away for training, and so I specialize in treating kids with blood disorders and cancer. So different than people who treat adults, we actually combine the two, and so I have been at UNM now 5 years, almost exactly, in our pediatric hematology and oncology division.
And I do have to say they do a great job over there.
Well,
so
yeah,
Jody does a great job
well,
too. So.
You've been on my radio show, and what struck me was the one guest we had on. He was an older 17-year-old, and that's old for childhood cancer. And he was actually told he was going to go to Mayo Clinic, and then he found UNM the childhood cancer treatment there, and he said he was so blessed because he went there.
Well, I'm gonna tell you,
I mean, it's grade A. The best care I've heard of.
I'm a 40-year survivor of cancer. October 18th is my 40th reunion.
Congratulations.
But I left 40 years ago. I left to go to MD Anderson because of that. Today I wouldn't. And I was 17. Today I wouldn't leave. I would stay right here at UNM Cancer Center. It's such a great center.
Yeah.
So thank you so much.
Yeah, of course, you're welcome. We treat complex patients, and part of the problem is that we want to make sure people understand that they can stay at home with their family and where their support is, which is really, really important.
Really
we have a whole family dealing with a cancer diagnosis.
But I got one question for you.
Yeah.
How's the insurance companies treating you?
Oh, horribly.
Because that's what we're here to talk about.
The theme of the hour, right?
Yeah, we're here to talk because we wanted, Jody, we wanted your perspective as a doctor, because I can't tell you.
Working with kids.
I can't, well, no, just doctors having to deal with the insurance companies. I have not met a doctor that isn't for a single payer system because they're so frustrated at the system. So a lot of doctors are like, look, I don't think Medicare for all is going to work, but I'd rather have that than what we have today. As a doctor, tell us some of your frustrations.
My frustrations are that I don't get to make medical decisions on some of my patients, which is actually why I went to medical school and went through 6 years of training afterwards. And so that's really frustrating when insurance companies are dictating to me what I can and cannot do within the realm of the standard of care for patients with particular cancers when I need to do that to determine their treatment plan. I had one 13-year-old boy who needed a very particular kind of scan done, and he ended up, the insurance company refused. And I did, I went up all the ladder of, what we call peer-to-peers, which is not actually what it sounds like, but went through all the review processes. The family appealed, the mother and the grandmother got on the phone, and they just flat out refused to do it.
Right. So when you say, like, who's refusing? The bureaucrats or the doctors? Do they have a panel of experts?
Yeah.
I mean, you know what I mean? Like,
both. So,
okay.
And I would use the word experts loosely because I have yet to do a peer-to-peer with actually one of my peers, meaning someone who treats kids with blood disorders and cancer.
Well, here's one of my issues, and I'm not dogging Presbyterian, but we left Presbyterian and we now have a third-party insurance company. I'm a cancer survivor. I want the freedom to go to any hospital I want to. And one of the biggest issues I had is everybody in my family was covered under press, except me. My doctors were not covered. So I was going to have to go to a press doctor, which, okay, I might be able to flexible with that. But when I asked the question, if I get a type of a cancer and want to go to UNM Medical Cancer, UNM Cancer Center, which is one of the top regional cancer centers in the country now, and I want to go there, can I have the freedom to go there? And they said, well, yes, only if we can't treat you. I said, well, hold on.
But I get afraid of with a single payer system.
But my point is, hold on. But my point is, who determines if you can't treat me? Right. They would never give me that answer. So we didn't sign up for that.
There is no answer.
There is no answer.
No.
And by the way, the single payer system, everything I've looked at, you're wrong. You would have the freedom to go to hospitals and you'd have the freedom to go to your doctors.
Okay, so explain to me in a world where there's one choice, where you're getting more choice. Right? A single payer system doesn't make sense to me because, again, the government's taking over and limiting competition,
See, you're saying,
which is the one thing that
by
makes...
the way, has the competition, no, I'm going to say this. Has the competition driven your premiums down?
Oh, no.
Has the competition, hold on, has the competition driven, that's my point.
But that's a whole Obamacare issue.
No,
that's a whole different issue.
And again,
No,
because
it's a managed care
it's a
issue.
managed care issue.
Okay,
and
go
again,
ahead.
we start this.
Managed care was before the Affordable Care Act.
Right, so
Far
explain
before.
that and explain, I wanted you to explain in a little better terms. When you say medical decisions, you're not able to make because of the insurance company.
Yes, so everything goes through an authorization process. I mean, and when I say everything, I mean every little thing. That would be routine standard of care anywhere in the world that would treat kids with cancer, especially more common types of cancer where everything is very protocoled. And so when it takes, several different staff members in our office to get one medication approved for one child with leukemia. Think about compounding that. And that is just my little world. That is my little world of medicine. And so think about how that compounds over time and over space and different specialties. It's just ridiculous that the hoops that have to be jumped through just in order to be able to do a standard treatment. The other thing is, so once it gets submitted, right, and through the insurance company, so they have their rules, and so they have I call it like it's a defensive lineman kind of thing that you have to go through. And so there's different layers of people. And so eventually kind of where I get involved is where it's what they call a peer-to-peer. So the idea behind a peer-to-peer is I'm explaining the medical rationale in addition to the letter and everything else that we've already submitted, which is packets and packets of paperwork.
Now, Mary, I want you to jump in here because we're talking a doctor's frustration with insurance. Under the New Mexico Securities Act, Health Security Act, explain to us, because you have a lot of doctors supporting you.
Yes.
And
pharmacists.
And pharmacists. How does that streamline where the doctors can practice medicine and not have to worry about the insurance side of it? Help us here.
Well, there are a couple of things. First of all, when you think about an insurance company, it's not just Presbyterian. Presbyterian offers over 100 different types of policies.
Right.
So different copays, different deductibles, all of that. And then they all have requirements for the physician, the nurses, everybody to fill out so that the claim can be paid. I think it's fascinating that, insurance is in for business, right?
Yeah.
They want to make money.
Right.
And what do they call what they pay out in healthcare? Medical losses. That's their term.
Right.
It's a medical loss. It's because it takes away from their profits.
Yeah.
And so a lot of the rules that doctors and nurses and hospitals have to go through are just whether we pay the claim. And there were, years ago, there were some congressional hearings that said the more they sit on those claims, even if they have to pay it out, they're still earning interest. on that money.
Right.
And so this simplifies life. Not only that, physicians are going to have a say in terms of how this is going to work. We want to develop, and this is why it's a co-op, we want to develop a physician, patient-friendly plan. Oh my goodness.
I want to ask one. I want to ask one question because we got about 4 minutes left with Mary, and I know Jody, you're going to stick around. But my party, or at least 40% of my party, because 60% of us don't totally agree with it. 40% of my party is pushing Medicare for all. In your experience, Medicare for all, the Health Security Act of New Mexico, both work similar, both work together?
They're very different.
Right.
When you're talking about a national plan, you can wipe out ERISA. You know, you can do. We're talking about a homegrown, homespun plan that's smothered in green and red trilly. That's New Mexican.
How does this affect Medicaid and Medicare?
You'd have to have permission from the federal government to make sure that nobody loses any of their rights, right. But that essentially, I'm a New Mexican, I'm not military, because the military excluded. Right. So I get this plan, I have my card, I go to the physician of my choice. That physician is paid a negotiated rate that will be higher than Medicare. Because the savings in this plan will allow not only good coverage, but it will allow physicians.
So hold on. In my mind, I get the view of, and I'm just trying to speak for the average guy, with hardworking guy with insurance right now. Why do I get this picture of like a Cuban hospital with government? No, well, I'm being honest with you.
They have really good healthcare.
By the way,
right?
Cuba has really good healthcare.
They have really
By
good
the way.
Why don't you try some other country?
You may want to pick a different
But Fidel did come here to get treated, by the way, because he had stomach issues. And if we're talking about
we got 2
but
minutes.
anyways,
Get your
yes, that was. Thanks for interrupting my point. So you get this sketchy government hospital with really crappy care in your mind. That's
okay. Hold on. Let me ask you.
Don't you think that's the insurance industry that's spreading that?
But hold on. Have you been to UNM Hospital? Hold on. Have you been to UNM Hospital?
Yeah.
No, UNM Hospital.
Presbyterian.
Okay, but I go to UNM. By the way, I would go to UNM before Pres. UNM is a government-run, funded program.
So much for Presbyterian sponsoring the show. There we go.
They're not a sponsor right now. So. But my point is, UNM has some of the best doctors, has one of the best medical schools, and that's, if you want to call it, that's a state-run program. State funded, it's state federal funded.
Let's take a look at the private hospital system. How about Carlsbad? What's going on in Carlsbad?
Don't know.
Oh, the people are getting sued. It's the New York Times wrote about it. It's one of the hospitals that's suing patients who have insurance because they're not able to pay.
Mary, we have about 30 seconds.
Okay.
So I want to make sure before you leave.
Okay.
Is there anything we haven't covered? As I believe in your organization, I believe self-insuring ourselves in the situation we are today, I think is a better way. Is there anything we haven't covered that you want to make sure that you're covering, or you want us to get your point across?
I think it's important for people to know that this is a homegrown plan. I think one of the best descriptions of single payer was single payer, married payer, divorced payer. Aren't we all going to pay? So let's not use captions like that.
Well, and I like universal health care much better.
Yeah,
because
and self-insuring makes a lot of sense in a state with a small population. And our website, of course, I hope people will be interested, is nmhealthsecurity.org. You can get lots of information on our website.
Anyway, thank you very much. We
Thank
appreciate it.
you
We'll
very
make sure
much.
we get it. Join us. Remember, you can join us on Facebook. Follow us on Facebook at Let's Meet in the Middle. And we're here. We'll be right back after these commercials.
We are connected by rivers, by mountain ranges, by unique culture. But what connects us more than ever? Renewable energy from wind and solar. P&M delivers renewable energy every day to our homes, businesses, and institutions across the state.
And they are committed to 100% emissions-free energy by 2040.
After all, we call this home too. P&M, together for New Mexico.
Ryan Sewing and Vacuum is New Mexico's #1 brother dealer. Brother's new Luminaire has a built-in projection system which helps with quilting, embroidering, and sewing. Ryan's has a variety of machines to satisfy quilters, sewers, embroiders, and long armors. We offer the finest vacuums like Miele, Riccar, and Lindhaus. Check out our fantastic selection of fabrics and sewing furniture. We also offer classes, repair, and financing. Drop by our store in Albuquerque and Santa Fe. Ryan Sewing and Vacuum, serving New Mexico for 37 years.
I'm Ben Lucero, president and owner of Indigo Mortgage. We are a locally owned and operated mortgage company right here in New Mexico. This means your loan officers and processors are right here to serve you. Indigo Mortgage offers better rates and terms than that of big banks and out-of-state lenders. Our mortgage divisions include residential, commercial, construction, reverse mortgages, and VA mortgage loans. Let us serve you with an exemplary level of care. Indigo Mortgage, because nobody cares more about your mortgage loan.
Welcome back to Let's Meet in the Middle. We're going to continue the conversation. It was
We've
so
asked-
good last
we've asked
segment.
Mary to stay with us instead of
Mary's
leaving,
staying,
so-
Jody's staying, and we're going to keep the conversation going because, again, I felt like as the guy in the middle, you know, the guy...
As the guy that's outnumbered on the
pretty
set
much,
today.
No, I don't worry about that. That doesn't bother me. What I want to understand is more of what we had talked about at the break, how this filters down, how it encourages more doctors. You seem very kind of tired. You've got paperwork exhaustion and fighting insurance.
Physician burnout is a huge thing right now.
Right.
And there's many proponents to physician burnout and suicide, but a
I
lot of it is this extra work.
But I want to clarify something that I said to you before he came on the set. So Dr. Jody had never heard of your organization before. So she's not here supporting your organization. She's actually here just supporting the insurance business is hurting medical doctors and it's not helping. We thought it'd be a good idea to bring both organizations together to talk about it.
Correct.
So I want everybody to know that Jody's not here. You didn't even know about the organization
Nope.
under the New Mexico Health Security Act before this.
And just to review, you know, Jody Mayfield, oncologist, childhood cancer doctor, and Mary Mary Feldblum is part of the New Mexico Health Security Plan. And this is the first you're hearing about the New Mexico Health Security Plan.
It is, yes.
Okay.
Now, as a branding person, it's been around 20 years. How do we get everybody passing this? Because that goes back to my biggest issue, is everybody I know besides the insurance companies and pharmaceutical companies, there's your issue, is happy with the way the system's going right now. No one else is.
Well, I don't know of anybody in my kind of income bracket, which is pretty much middle class income,
Which is not
that is
insurance.
happy with insurance. I don't know anybody. I haven't met anyone.
questions
I don't even remember the last time I
again,
met
it
somebody
goes-
that said, I have a great insurance plan.
Again, it goes back to the New Mexico Health Security Act, basically saying we can self-insure ourselves and take care of it ourselves. And it goes back to every discussion we have had, from education to everything else. Let us insure ourselves, let us take care of ourselves, let us solve our own problems. By doing this, by creating, because we haven't even touched into this, by creating this, we actually then can renegotiate for the entire state pharmaceutical costs and drive those costs down 78% when we ran our numbers. 78% lower pharmaceutical costs.
That in itself would
So-
be such a big
Would
difference.
be a huge win.
Huge difference.
Right. So again, Mary, let's attack what this plan is, just as simply as possible. Again, you've been working on this for 20 years.
Yeah.
So you've
but
worked
it's
through
changed.
how many presidential
let-
administrations?
But
20
it's
years,
really
that's-
changed over time because of feedback we're getting, you know, and of course the situation changes. Once the Affordable Care Act was passed, for instance, we pushed for a waiver for state innovation, sections 1332 in it, so that a state wouldn't have to have an exchange. Our exchange, it estimates were 55,000 people would join it. We're a very small market. We don't even have that now. It's, you know, whether
And it's costing us $34 million a year last time I looked.
yeah, and then of course prices are going up. The Affordable Care Act reduced the rate of uninsured, but what hospitals are feeling is that people come in and they can't pay their deductibles, their co-pays, and of course they're jacking up prices.
I'm going to try and simplify this for Eric. So the point is, and I'm making up a number, but we think it's around 17, 18, 20 billion dollars. That 17 to 20 billion dollars that's going through the insurance companies would go through a self-insured program in the state of New Mexico that would be housed for us. Those costs would go out. I know the profit margins at the insurance companies, those profit margins would stay here in New Mexico. And we're estimating, I think this is what this research piece, we're estimating if you're looking at 17 to 20 billion dollars in the overall fund to self-insure us, you're looking at $400 to $500 million a year of interest that New Mexicans would make. within that fund. Am I correct or wrong?
Well, but, yeah.
And I'm rounding numbers just because we're not really sure about those
the
numbers yet.
I'm a social scientist, so numbers make me nervous. But at any rate, but the idea that there would be the interest off that huge amount of money would be ours, and that you have to build in a reserve fund, of course, but you also then can help pay for infrastructure, rural infrastructure that is desperately needed.
Hold on.
That is desperately needed.
Tell us where we're at right now with the New Mexico Health Security Plan.
Act?
You have a fiscal analysis going on.
The legislature approved funding for the Legislative Finance Committee, which consists of both houses and both parties, to hire the consultants, because this is something that you need some consultants with, to figure out what we're spending on healthcare, because we don't know, and then what we would spend under the Health Security Act plan, and what kind of savings would there be, including pharmaceutical, drugs, and physician overhead, and what kinds of additional expenses there would be, and then the revenue side. You know, how do you pay for this cost? And the plan assumes the services offered by teachers and state employees were exactly the same, which is a really good package of services. And the insurance industry can offer supplemental, and there's lots of ways it can offer supplemental.
I can tell you right now, 4 years ago, we ran the numbers based on numbers that we could get before I ran. I put white papers together, as we do in the business world, to map things out. I was paying about $1,600 a month, so I was paying about $32,000 a year in healthcare coverage. And I'm not saying this plan, but I'm saying a universal healthcare plan, self-insuring ourselves, and able to negotiate those costs down. Jeff Apodaca's family was going to save $8,000 a year on insurance costs or health costs.
Jody, you said you had good insurance, and so as a doctor, are you, now that you've heard more about the New Mexico Health Security Plan, is this something you would be in favor of? Does it feel like it would be something that could work for New Mexico?
Absolutely. I mean, you know, you have to go through the process like you do with any huge paradigm shift, as you termed it, of analysis, but absolutely I do. I think that what is going now is not working, and I think the sooner we figure that out, and nothing is going to be a quick fix, so we all just need to get that out of our heads. That is not going to happen. Change takes time, and this kind of change takes what will probably feel like glacial time.
At the same time, we have to work with the hospital side, whereas, like, you know, again,
and we can't disrupt care.
We can't disrupt care.
We cannot disrupt.
We also have to look at, and one of the big plans we were going to do, and I talked to press, I talked to UNM, I talked to Lovis about it. We will invest together. We have to create urgent care centers around the state and next door to the emergency rooms, because emergency rooms have to be for emergencies. And so again, those lower costs too. So it's a multi-level element to it that we can take a look at.
So one important thing to keep in mind is, yes, we have to keep the current system floating, but many of the programs cost money, and you know, maybe oil and gas revenues can pay for that, but the long term is important. But I think one of the most interesting things that's happening in the legislature, Senator Jeff Steinborn passed a pharmaceutical purchasing council. And the idea is that, let's see, if 9 state agencies and the cities and counties decide to purchase drugs, and maybe even look at the private sector, and do bulk purchasing of drugs, what kinds of savings will be. The fiscal analysis of that bill was fascinating, because it said millions and millions of dollars, and that would be saved.
You would drop your, I've already done the numbers, I'm going to call the senator up. You would save about 78%, because we did the numbers. By the way, majority, besides cancer patients, majority of the patients in the state use generic drugs. And generic drugs are basically, our plan was generic drugs are basically manufactured in 2 countries, India and Israel. We would then set up a shop, import them. We'd have to follow FDA regulations and relabel them. I would control the cost, and I would basically put a 5% profit margin in there for operations. Other than that, that would drop the cost down by 78%, and you wouldn't have to go to the Walmarts of the world. Now, I personally think the state wouldn't have to do that, because if the state thought about that, every Walgreens, every Walmart in the world would lower their cost and cut that as a profit margin for them to make sure we retain those businesses. So I think there's great opportunity there.
And there are lots of experiments going on in a variety of states. The state of Utah, 2 Republicans introduced a bill saying, yeah, we're going to import from Canada. You know, I mean, I was just, you know, I mean, it's an issue for many, many states. And so programs like this that potentially can save money, and others that we deem are worth investing, even though they may not save money right away, but it will help you know, keep the health care and the sanity of our doctors. But we're having trouble with rural hospitals. There's something, the bill has, the Health Security Act requires budgets for hospitals, negotiated operating budgets. This is something done in Europe, in Canada, Japan, and Maryland is experimenting with it. So why don't we set up some kind of a group that will look at global budgeting, which is called, you know, for our rural hospitals, which are in big trouble. And to see how, you know, how could we make that possible in New Mexico? I mean, we can learn from other states, but you know, we'll get some other ideas.
We have about a minute left, so jump on in because we still have.
Yeah, Jody, your final thoughts on just where do you think the future of healthcare lies, and you know, is insurance our biggest problem right now in terms of the doctor side and the doctor burnout?
I think that, so fundamentally, I believe universal health coverage is important because I think accessible, quality health care is a right, not a privilege. And so I think if we can get people to agree on that, that will help us move forward in a different way. And I understand that not everybody does believe that. I think that there are many things wrong with the healthcare system, and you could have a whole nother show about the medical education, you know, the costs of producing providers and why there's going to be a doctor shortage in 2032 that we've probably all heard about. And so I think that, you know, what we have going on right now is better than it was, but could be a lot better. And I think that at some point, the American public or the New Mexican public are going to have to bite the bullet, and we're going to realize this is not working and we need to do something different.
We're there, by the way.
Yeah, I think we are.
Think about it, Eric. You're already sitting there going, "This isn't working." You're complaining. We have to be open-minded to start looking at.
I've had a lot of pushback. I've been doing a lot of absorbing here.
That's fine.
Very good
my fear, by the way, is as it always is. Anytime you limit free enterprise and competition, I get nervous. So,
anyway,
there you
ladies,
go.
thank you. We're going to have to cut it there. Thank you so much for coming on today. We'll make sure that your websites are up. We'll be right back after this moment.
Ryan Sewing and Vacuum is New Mexico's #1 brother dealer. Brother's new Luminaire has a built-in projection system which helps with quilting, embroidering, and sewing. Ryan's has a variety of machines to satisfy quilters, sewers, embroiders, and long armors. We offer the finest vacuums like Miele, Riccar, and Lindhaus. Check out our fantastic selection of fabrics and sewing furniture. We also offer classes, repair, and financing. Drop by our store in Albuquerque and Santa Fe. Ryan Sewing and Vacuum, serving New Mexico for 37 years.
I'm Ben Lucero, president and owner of Indigo Mortgage. We are a locally owned and operated mortgage company right here in New Mexico. This means your loan officers and processors are right here to serve you. Indigo Mortgage offers better rates and terms than that of big banks and out-of-state lenders. Our mortgage divisions include residential, commercial, construction, reverse mortgages, and VA mortgage loans. Let us serve you with an exemplary level of care. Indigo Mortgage, because nobody cares more about your mortgage loan.
We are connected by rivers, by mountain ranges, by unique culture. But what connects us more than ever? Renewable energy from wind and solar. P&M delivers renewable energy every day to our homes, businesses, and institutions across the state.
And they are committed to 100% emissions-free energy by 2040.
After all, we call this home too. P&M, together for New Mexico.
Welcome back to Let's Meet in the Middle. Jeff Apodaca, Eric Strauss.
Have you done the raffle for the free healthcare?
Give it all away. It's free.
Okay, well, wait. I think Mary and Jody, and I love Jody to death, by the way. I think they did a great job. I know you're skeptical about new things and about government-run programs, but I think Mary did a great job. This is not a government-run program.
Mary is trying to Jedi mind trick me. She was looking through me and not at me. I was like, yes, free health care for everybody.
It's not free.
Like, yes,
it's not free. By the way, I know we were promoting.
That's a joke.
I know we were promoting free health care, but it's not free health care. But it's a self-insured program.
Every American can get behind the fact that the insurance companies are making a lot of money off of healthcare.
Well,
We all understand that.
So here was when I ran for governor, we looked at a plan, and I pitched universal health care, and I looked at a self-insured program, and then literally I'm giving these TED Talk things, and down in Las Cruces, some friends of ours approached me who are very involved in the Health Security Act of New Mexico, and they said, you know, Jeff, we already have this plan. So when I looked at it, Eric, here's what we can't agree on.
Why?
Hold
Okay,
on,
so
here's what we can't agree on.
Mary's been working on this for 20 years,
Yes.
number one. I'll listen to a lady that's been working on something for 20
But
years.
here's what we can
But
agree
yes.
on, I think, between Dr. Jody, between Mary, all of us. What we
Yeah.
do agree on, what we have today isn't working, and we're coming to a cliff. So if we don't start doing that right now, and again, the more and more the insurance companies are creating these verticals with our hospitals, and in New Mexico, many of them are nonprofits, it's an opportunity that we have to look at ourselves and say, okay, can we self-insure ourselves? And there's models out there that have proven that it works. Can we self-insure? And I think one of the things that we didn't really dig into that I think was Mary's point was, if we all buy into a program and we all self-insure a program, that money is ours living in a bank, creating interest, paying expenses, so there's no profit line. So that 16 or 32% profit margin the insurance companies are making, whatever that number is, some will say 8, that money is staying in the pool helping New Mexicans out.
The business side of me is anytime you can run the numbers and show that it's viable, that you can increase doctor pay, increase the quality of healthcare. But again, I'm just looking at this for the first time. So in my world, the things I differ on are, is healthcare a right or a privilege? Well, I think when people look at it as a right, it really kind of slaps the hardworking person in the face and say, look, you also have the right to not have 5 babies and that's a whole different conversation. But that's where you get pushback from my side of the coin.
And I get that. And I don't want
affordable, yes.
But
cover kids, yes.
But my point,
right?
yeah. But my
quality,
point is,
yes.
let's not get caught up into, because we do this too many times. Let's not get
The
caught up
verbiage.
into let's not get up it's a right or whose right is or what. Look, bottom line is, if we don't take care of
Run the
people,
numbers.
if we don't take care of people and insure people as a group, the costs are continue to go up. Obamacare had a good idea, but they didn't cover the two big things, insurance and pharmaceuticals. I mean, we even talked about off air, there are states now trying to negotiate pharmaceuticals from Canada to drive those costs down, and we see what's happening. So it's again, I'm in favor of a universal insurance program that we self-insure and take care of ourselves and take care of New Mexicans. I happen to believe this is a good plan to do it.
I'm in favor of a quality health plan. So if you're telling me that you can cover everybody and do it in a quality way and save money and increase doctor pay and increase the quality of care, which of course I'm skeptic about, I'm saying I would be for that if you run the numbers and you do it the right way.
Do you agree what we have today is not working?
I would agree that my insurance costs keep going up. Yes.
So it's working for you going up?
Well, no, it's not.
That's my point.
But but I'm not going to sit here and say, let's throw out my health care and my family's health care, and then I'm going into a government-run hospital where the health care clearly is not going to be.
I have no problem going into a government-run hospital when it's
quality.
UNM Cancer Center.
If it's quality.
When it's UNM Cancer Center or UNM Hospital, they're doing their great job. So
agreed
our biggest
on that.
issue, my concern also is shortage of doctors. So, but I think we have to take a look at
But that's going to be a
this.
show for a different time.
Well, I know,
just
but
even
again,
addressing that,
Jody talked about it. I think we're looking at that. We're driving things away. So, anyway, we're going to be right back after this to wrap up the show. Thanks for tuning in. We'll be back after these commercials.
We are connected by rivers, by mountain ranges, by unique culture. But what connects us more than ever? Renewable energy from wind and solar. P&M delivers renewable energy every day to our homes, businesses, and institutions across the state.
And they are committed to 100% emissions-free energy by 2040.
After all, we call this home too. P&M, together for New Mexico.
I'm Ben Lucero, president and owner of Indigo Mortgage. We are a locally owned and operated mortgage company right here in New Mexico. This means your loan officers and processors are right here to serve you. Indigo Mortgage offers better rates and terms than that of big banks and out-of-state lenders. Our mortgage divisions include residential, commercial, construction, reverse mortgages, and VA mortgage loans. Let us serve you with an exemplary level of care. Indigo Mortgage, because nobody cares more about
Ryan Sewing and Vacuum is New Mexico's #1 brother dealer. Brother's new Luminaire has a built-in projection system which helps with quilting, embroidering, and sewing. Ryan's has a variety of machines to satisfy quilters, sewers, embroiders, and long armors. We offer the finest vacuums like Miele, Riccar, and Lindhaus. Check out our fantastic selection of fabrics and sewing furniture. We also offer classes, repair, and financing. Drop by our store in Albuquerque and Santa Fe. Ryan Sewing and Vacuum, serving New Mexico for 37 years.
Welcome back to Let's Meet in the Middle. So I
Did
guess
we meet in the middle today?
we're in the middle on quality. We're in the middle on if it can save money, and we're in the middle on if this study says what it can do and it's accurate. And I'm talking about the New Mexico Health Security Plan, and you can find it on your own. We put the website up, but at NewMexicoHealthySecurity.org.
Right.
And have people,
and
I would encourage anyone to do the homework on it.
Well, there's 170 organizations. You
Yeah,
heard
that was
Jody,
impressive.
the doctors are
Impressive.
behind this. There are 36, 38 cities and counties behind it. According to their website and according to Mary, the governor's supporting it. So it sounds like everybody's kind of lining up for it. What we all agree on, what we have today is not working. Our costs continue to go up, and the pharmaceutical costs continue to go up. Insurance and hospital bills keep going up. So I think we have to look at these opportunities. And again, there are models out there that have proven it works. Let's self-insure ourselves. You've heard me talk many, many times across the board. Let us take care of ourselves. Just give us our grant dollars, and we can make it better. We can do it better.
So, and my whole point is, if the numbers can show that we're not, I always get nervous when the government starts taking over everything. So that to me is always going to be pushback from me.
Again, let's go back to
government-run hospitals, government-run doctors. To me, I'm afraid of that.
But let's go back to Mary's point. This is not a government-run program. I want to make that very clear. You keep calling it that.
Well,
it's not a government-run program.
So, and again, you can do the homework on your own. We're going to be talking about mental health soon, too.
Oh, next week.
Yeah.
We're going to talk about mental health next week.
And I think that's going to be a really poignant and important show that we're going to do.
And we're going to be talking mental health both at a young age and an older age and at the veteran level, but specifically at a young age. So anyway, I hope you enjoyed this week's show. Hey, New Mexico, never give up. Always find a way.
Go out and make a difference in the world.
God bless you guys.